Hi, my name is Satara. I'm going to do my skills video on prenatal education precaution. I will provide privacy and then hand wash and then identify my patients by asking their first and last name with their birthday and to start, we're gonna start with the foods that should be avoided during pregnancy, and the raw and undercooked foods like seafood, eggs, or meats. And there are risk of bacterial infection like salmonella, and listeria, and then also unpasteurized dairy like milk, cheese, and there are some risk for listeria that they cause miscarriages, and also high mercury fish like shark, swordfish, and that also can cause neurological damage to the fetus. And then alcohol, it is not safe at all to pregnant woman because it can cause fetal alcohol syndrome. And the medication over-the-counter supplements is safe to use Tylenol for mild or severe mild pain or fever, and then prenatal vitamins are essential for the fetal developments, especially folic acid. It prevents neural tube defects, and also iron supplements if the pregnant women are anemic, and then calcium and vitamin D, that's for bone health, and then also vitamin B6, that's very good for nausea and vomiting. And then the medication over the counter that the pregnant woman needs to avoid is the NSAID like aspirin, ibuprofen, naproxen, because these medication can cause heart or kidney problems in the fetus. And then also the congestions like phenylephrine, and because it can affect blood flow to the placenta. And then also herbal supplements also under regulate and can be harmful. And then some antihistamine like first generation can cause drowsiness or other effects. And for environmental exposure to avoid like pesticides and household chemicals, because it causes birth defects and developmental issues. And secondhand smoke also increase preterm birth, low birth weight, and then SIDS. And then also lead exposures like old paint, contaminated water. It can also lead to cognitive and developmental delays. And then alcohol, tobaccos, or substance use. Alcohol can cause fetal alcohol syndrome that leads to intellectual disabilities or facial abnormalities. And then also there's no safe amount during pregnancy for tobacco or vaping, nicotine replacement therapy. There's an increased risk of preterm birth, low birth weight, or placenta abruptions. So that's why it's not safe to take it during pregnancy. And also it can for the other drugs like cocaine, heroin, marijuana, they also lead to neonatal abstinence syndrome, that's withdrawal in newborns. And then marijuana can also affect development and increase stillbirth risk. And then travel precaution during pregnancy. Safest time is the second trimester between 14 to 28 weeks because of less nausea or vomiting, and also there is a lower risk of preterm labors. And then for preparations, you have to stay hydrated and avoid prolonged sitting to prevent deep vein thrombosis. And then also you can wear compression socks for circulations, and then also carry prenatal records in case of emergencies. And then places to avoid pregnant women, like high altitude areas, because of the oxygen levels may be lower over there, and also regions with Zika virus or other infectious risk. And when it's not safe at all to travel, if the patient is experiencing high risk pregnancy, like patient is having preeclampsia, placenta previa, or multiple gestations with complications, and also after week 36, because labor may start unexpectedly. And then dental care during pregnancy. Best time to visit the dental is week second trimester, between second trimester, because it is safe, and then there is safer procedures, nausea, vomiting. For the first trimester, decreased, and then also the uterus is not large yet. And then safe procedure is regular cleaning and exams, filling, and simple extractions with local anesthesia. And then also dental x-rays is safe with abdominal shielding, but best to postpone it unless it is necessary. Some common issues during pregnancy, like gingivitis due to hormonal changes, increased risk of swollen and bleeding gums, and also tooth decay, increased acidity in the mouth from morning sickness. And then by avoiding these precautions, you're gonna have a healthy pregnancy.